Good afternoon. Thank you for joining us for this community town hall. Today, we're joined by Claudia Paul with Global Language Services, and she will be interpreting simultaneously for us. Please follow the instructions that Claudia is going to give us right now to be able to listen in Spanish.
Hola, buenas tardes, bienvenidos a todos. Gracias por estar aquí en este Community Town Hall reunión. El día de hoy está aquí Claudia Paul, ella va a ser una intérprete, ella está por medio de Global Language Services. Por favor, escuchen las instrucciones que se van a dar para que puedan escuchar la versión en español. Thank you, everyone. In a few minutes, we're going to have the interpretation feature turned on, and everyone will need to choose their language of choice. Once you do that, in the bottom of the screen, there will be the button. It's a glove. You will choose your language of preference, as well as click mute original audio, and then you shouldn't have to do anything after that to hear the version in English. Hola a todos, en unos minutos van a encender la aplicación de interpretación. Va a haber un mundito en la parte de abajo de su pantalla. Una vez que se encienda, por favor, hagan clic en el botón de su lenguaje de preferencia y también pongan Mute Original Audio o sin silencio al audio original. Thank you.
And I see the interpretation has just popped up on the bottom of the screen for everybody to select their language. Give another second for everybody to select their language. Okay, well, thank you, Claudia. Appreciate your offerings in Spanish. So Valley View is an independent, not-for-profit health system that is based in Glenwood Springs, Colorado, right here, and is proud to serve its patients and certainly understands that there are many, many health needs in the community, including COVID-19, alcohol and substance abuse, mental health, diabetes, heart disease, stroke, cancer, motor vehicle accidents, healthcare access, and much more. As a communications expert with my own public relations agency, I know how incredibly valuable it is to proactively share news and information with the greater community. As someone who knows and loves Valley View and its incredible work very, very well, it's my pleasure to serve as your moderator today and facilitate a conversation that addresses healthcare topics that so greatly impact our community. During this virtual event, Valley View will share its recent work and community investments over the past year and discuss its ongoing strategy and community investments for the upcoming year. We are excited to welcome you all, and we're here to answer any healthcare questions that you may have. So with that, I would like to introduce the following Valley View executives. Josh Anderson is the Manager of Safety, Security, and Emergency Management at Valley View. Stacy Gavro is Valley View's Chief Community Relations Officer. And Rob Nelson is the Executive Director of Quality and Safety at Valley View. All right, so with all those introductions, we're going to jump right in. And the first topic is going to be COVID-19, which is Josh will be participating. So Josh, COVID-19 is still obviously a very critical issue for many in our community. What has Valley View been doing this past year to respond to the pandemic?
DeRay, thank you so much for that question. So over the last year, Valley View has formed together what's called an incident command team. It's made up of administrators, physicians, nurses, and other clinicians throughout the hospital. We meet daily or even twice a day in some cases early on in the pandemic. And it's specifically, we invested in not only environmental changes, PPE, state-of-the-art PAPRs, and then testing, and then obviously the vaccine as well for our community. So to date, we've served almost 300 patients that were tested positive for COVID, and then provided 32,000 tests for the community. In healthcare, it's important not only to diagnose a positive result, but also gives peace of mind for negative results. And then it's become such a part of our community and our lifestyle now to have this information at hand. So it's a great service that we're able to provide. In context of the vaccine, we've provided over 90 point of dispensing. So you've heard the term POD, P-O-D, point of dispensing operations for our community. We've vaccinated over 12,000 individuals, and that's accounting for 24,000 vaccines because it's a double dose series. We continue to remind folks that this is still a great and safe environment for individuals to continue care. And we just want to take this time to thank everyone in the community who's helped support us over this last year. It means a lot to our clinicians and our staff to just, have that warm sense of thank you and engagement in the community.
Well, we thank you all. So I speak on behalf of the community. I know it's been, something that nobody could, I don't think anybody could have dreamt this up. And certainly, as you mentioned, our life has kind of changed, and getting the test and getting that peace of mind. So thank you all for what you've done. So the next question I have is kind of like, looking ahead. So obviously this is the news everybody's asking about and hearing about. So can you share the response, to the news, obviously that's been coming out about the third dose for the immunocompromised individuals? And also what about those 2 to 12-year-old that we're waiting on those updates as well too on?
Yeah, great question. So in regards to the immunocompromised third dose, everyone's status is different. Everyone got vaccinated at different times. So we're just going to encourage you, work with your PCP. They know your health conditions and your status the best. So contact your PCP. They'll be able to get you taken care of. In regards to the below 12 years old, we continue to work very closely with our state and federal partners. So our incident command team works directly with the local, state, and feds to get the best guidance, and we will be ready when that day comes to administer those vaccines as well.
No doubt. Well, thank you again. And I do want to flag a couple of things. One is that we are including within our chats links to some very valuable locations on our website, pages, that would be very handy for anybody who's listening that may want more information. So keep an eye out in the chat box of the feature on Zoom for that. And then in addition, we wanted to flag that if anybody wants to ask any questions, you can certainly do so by clicking on the Q&A down at the bottom of your screen, similar to where the interpretation was. And you can put questions in there that I will keep an eye on and certainly read out for our panelists to answer those questions. So I did want to point those two things out. And with that being said, I'm curious, I don't know if anybody has any questions about COVID-19, anything that's been done or anything that we've just talked about. So I see that link to the primary care page is posted in the chat. As a reminder, I'm not seeing any Q&As. So I think this might mean that Josh, you might be done here.
Okay. All right. Thank you everyone so much for your time. Have a great day.
Thank you so much for all you do.
Thank you.
Okay, great. So now I'm going to turn it over to Stacy. So Stacy, I understand Valley View has made some really exciting investments this year to help our community get timely, quality care when they need it. And I'm hoping you can talk about what those investments are.
Yeah, absolutely. So again, thrilled to be here with everyone in the community. And I think, Valley View has been here since 1955, and time again, we have looked at really playing this unique role in our community as a rural healthcare provider and constantly talking about how can we improve healthcare access. And I think one of the exciting things that we did last year is that we opened an after-hours urgent care. We kind of formally went live with it in 2021. We had a little dry run in December, but when we look at the network of care that Valley View offers, from here at the hospital and our emergency department in Glenwood Springs to our primary care practices around the community, where is there a middle ground where there's an individual who needs timely care but they don't necessarily have an issue that requires an emergency department level of care. But maybe it's a Sunday evening and the kid is really suffering and there is not time or the ability to get in to see their pediatrician or primary care practice. So our after hours urgent care really tries to create a new point of access for our community members where they can get timely medical care that frequently is less expensive than a visit to the emergency department. And I will say that the response from the community has just been incredible. Our volumes have been growing. I've had the opportunity to bump into some of our patients in the grocery store, and they just are really affirming of that experience, particularly because how we've constructed our after hours urgent care, it's literally adjacent to our emergency department. So people can come into the hospital and they'll basically self triage. They will decide, based on how I'm feeling, what's going on. Do I need an emergency department level of care, or can I go to urgent care? And then in the same kind of thought, if someone's in urgent care and perhaps they're having more of an acute health issue, our ED team is literally right next door. So that's really been an investment we've made in promoting healthcare access in our community. And then I think another exciting thing we did is we opened a new office in Aspen for our incredible orthopedics team. This team represents longtime fellowship trained orthopedic surgeons who've been in the Aspen community for decades, raised their families, have just been incredible members of the community, but also expert partners in caring for patients. And so we're so proud to have Valley Ortho have a new Aspen office. And really the intention there is to make sure that as we look at our community, we really have orthopedics care that truly focuses and values our patients. And so those have been two developments that are just, I think, an incredible example of how we're constantly having conversations about making sure that our community can access the best healthcare.
Certainly, and so well received. I would agree. Everybody seems to be quite excited about these new offerings. And certainly for those living in a rural community that may have to travel great distances for specialty care, I know that's an exciting part of what we're able to offer. So I know, I don't know if you have anything else to add on that, but I know that's also part of this and kind of being able to, expand further, into that rural community and not having to drive so far.
Yeah, I think you touched on a great point. We have these huge spanses of geography here in our community. And so Valley View, in partnership with Aspen Valley Hospital, Grand River Health, we're able to make sure that our community as a whole can benefit from these specialists that otherwise people may have to travel great distances to. So top of mind is we have an incredible medical oncologist, Dr. Stephen Mayer. He works here at the Callaway Young Cancer Center, comes from an incredible background on the East Coast, background in molecular biology, is now practicing here. And in working with Aspen Valley Hospital in Grand River Health and Rifle, he is now traveling to those communities and providing medical oncology there. So as a whole, our community benefits from having this specialized level of care, but for an individual patient who is facing a diagnosis of cancer, it means they don't have to travel far. It means that if they are going through treatment and having some of the side effects from that treatment, they don't have to worry about driving those far distances. So I think whether it's Dr. Mayer, we also have our neurosurgery, our cardiovascular teams are all out serving the region, which I think is really exciting, not only for us here in Glenwood Springs, but really lifts the community overall.
Terrific. It's been just so well received, as we've talked about, and we can't thank you enough for doing that. And then I think the other thing is just, really another really important point that we want to address is just how Valley View is working to address the cost of healthcare and certainly making sure that, we still have the high quality care here locally. I know that's an important question that a lot of folks have.
Yeah, absolutely. I think we absolutely understand and appreciate the cost of care can be a barrier. And so whether it's here at Valley View or in collaboration with others, we're still working on that. And so In the community, we're proud members of the Valley Health Alliance, which is a regional collaboration that includes not only key employers in the area, but key healthcare providers, really looking to not only ensure we have high quality care available locally, but also have affordable care. And so we've been working with the Valley Health Alliance for years, and it's something we're going to continue to work on into the future. And the implications for our community members is when they go to look for insurance, what we're trying to do is make sure that they can have a high quality, high value insurance product available on the market for them. And then here at Valley View Hospital, I think something that we're really proud of is our financial assistance policy. So for people who come through our care, we want to make sure that we're here for them, we're available, and we want to talk to them about how we can address any financial barriers they may have. And so for our financial assistance policy, we have a policy that focuses on incomes of up to 300% of the poverty level can qualify for hospital bill assistance. And to translate that a little bit more, it means that a family of two with a gross annual income and assets of $51,720 can have their out-of-pocket patient expenses reduced by about 80%. And then if there is a family of four with a gross annual income and assets of up to $131,000, their inpatient bill could be reduced by 50%. So again, I think when we look at our community members, when we look at the incredible workers that we have, I just want to make sure that the community knows that we're here and we have these programs in place, and we want to work with them. And we have other programs that are also available. And kind of when people reach out to me and say, you know, Stacy, how can I work with the hospital on my hospital bill? You know, my recommendation is always to either go online, and we'll put that link in the chat here, but also just call our financial assistance team directly. And that number is 970-384-6892. And those are real human beings on the other side of the line who want to talk to people about how can we work together to address those financial barriers.
Terrific info. Thank you. I know that's very, very helpful. We do have a question, so I'm going to ask you this question. Do you need an appointment for after hours urgent care, or can you walk in?
Great question. You do not need an appointment. You can just walk on in, and that is part of the value of this service, is that you do not need an appointment.
Great. Okay, I think that was it. Making sure, yep, that link is in the chat if you want that link for the financial assistance, just a reminder there. And I think that means that we are going to move on to Rob. So I just making sure there's no other questions that have come in, and I think we're good. So Rob is up. So Rob.
I'm so happy to be here with you guys, and thank you for the people who have joined us on the call for some of the information to share today. Just a little bit of context. I'm a physician assistant here at Valley View in our internal medicine office, so a primary care provider. I also specialize in diabetes care, so I'll be talking a little bit about that today before we wrap up. And then also serve as the executive director of quality and patient safety at Valley View. So I wear a few different hats in my role here. And I'm happy to talk about some of the great things that I feel like Valley View is offering and have added to what we bring to patients and in the community based on our historical community health needs assessment, which we're actually completing again this year. So
perfect. So let's dive right in. COVID-19, obviously it's created challenges on so many fronts. And for many, this has certainly included challenges with anxiety, fear, and depression. I think that's all of us have certainly experienced that, during COVID. How does Valley View care for the mental health of its patients, especially with the ongoing challenges of the pandemic?
Well, great question, DeRay. I mean, couldn't be a more timely one with everything going on with COVID. I completely agree. And we certainly feel that firsthand in primary care and see that with many of our patients. So Valley View's done a number of things to help address this, both acutely and as well just in general, offering good services for our community. In the first one I'll mention is, we have integrated behavioral health specialists at each and every one of our primary care practices, from our pediatrics practice to our family medicine and internal medicine practice. And even at our women's health clinic, we offer designated clinical social workers to offer integrative behavioral health, which is crucial because not only does it enhance access in the community in general, but how great is it to have a one-stop shop where you're seeing your doctor and you can really reduce the unfortunate stigma that often exists around behavioral health, and just pivot right into seeing a behavioral health specialist. And maybe that's for a couple of visits. Maybe it's just you're experiencing a little bit of grief around COVID, or just something more routine like the unfortunate loss of a family member or something like that, and you really just need a 1 or 2 visit opportunity to kind of discuss that and get some things off your chest, or go further with additional modalities of therapy that either that integrated behavioral health specialist can provide, or recommend a key referral opportunity to somebody else within the community that those individuals have a great pulse on, or who in our community is really expert in what areas of mental health. And so really a key resource there. I also wanted to highlight that we've expanded our psychiatric office. Is no longer just comprised with Dr. Pete Wiley, one of our well-loved psychiatrists here at Valley View with a lot of experience. But we have just in the last year added 2 psychiatric nurse practitioners who work closely with Dr. Wiley to expand access to care. And that's really huge. Psychiatric mental health providers, psychiatrists, and psychiatric nurse practitioners, it's a bottleneck, not just in our community, but in all communities. And so to be able to provide that expanded access is something we were very, very excited about and are now fully to scale on. So that's exciting. And then another piece I wanted to mention, a couple other examples, but a big one for us is the Zero Suicide Initiative. Aside from COVID even, but certainly something that COVID has worsened, is the unfortunate truth that suicide is more common on the western slope of Colorado than Colorado as an average, or the nation as an average. Suicide is a big problem on the western slope of Colorado, and we take that extremely seriously. We want to be not just proficient, but we want to be the best at recognizing warning signs and being able to offer services for patients in a time-sensitive fashion that really can get at lowering the risk of suicide for individuals that we might be seeing across our practices. So the Zero Suicide Initiative is designed to do exactly that. It's comprehensive. It entails baseline and repeat surveying for everyone in our organization. That's our providers, that's our nursing staff and support staff, that's our folks who worked in maintenance facilities and housekeeping. That's the folks who work to park your car when you might come in for services. Everybody in our organization needs to have this familiarity and awareness and be able to know how to take the next step to help someone should that need present itself. So Zero Suicide is pretty exciting here, and we're just getting launched on that this year here in 2021. So hopefully that gets at some of those pieces, DeRay, to address mental health, especially during COVID.
Such important information. And is there anywhere in particular that people should call or go to get more information on any that you just spoke about?
Sure. The best resource that I would highlight is if someone's already established with a primary care provider, that's probably the best place to go first. Of course, there are mental health hotlines that are specific nationally or in Colorado. The Zero Suicide Initiative itself, we can post, I believe, the link for our Zero Suicide Initiative here in the chat. But I would always encourage somebody to speak with their primary care provider. But if there's an urgent need, if somebody feels like symptoms of hurting themselves or any kind of those thoughts, it's important to turn to an emergency service, whether that's our emergency room or calling 911 or one of the emergency hotline numbers that can be found through the Zero Suicide Initiative or through the state websites. So we want to be accessible in any way we possibly can, Ray.
Well, thank you so much. Incredibly informative and lots of resources. So we thank you for your work as well. And you know, please pass that along to everybody. We know that the pressures lately, especially with COVID in the mental health field, are just incredibly you know, difficult and more demanding than ever. So we know how hard that is, and we appreciate all your efforts, and certainly excited with the Zero Suicide Initiative, because there's no doubt it's going to make a big impact within our community. So thank you.
Of course.
All right, so I don't see any other questions. I think that means, Rob, that I think we're good. And I think this means I'm going to jump back to Stacy. So Stacy's back up on. And thank you again, Rob. We appreciate it.
You're welcome.
Okay, so Stacy, Valley View's most recent health community needs assessment shares that alcohol and substance abuse is a top health issue within our community. And I'm hoping you can share with us how you are addressing this.
Sure. Yeah. So I think this topic perfectly dovetails to what Rob was describing in terms of how we're looking at mental health issues and how those can frequently intersect with alcohol and substance abuse. And so I think across Valley View, we have our points of care locations where we can work with patients should they have an alcohol or substance abuse issue, talking that through with their PCP, their primary care provider, to hopefully start a road to recovery. I think something that's exciting to share with the community right now is our efforts that have been over many years to bring to fruition a new community detox. So the idea is, you know, whether it's a person who's struggling with alcohol or any other substance, how do we provide them a safe place to manage their detox? And we're really fortunate to be part of a very broad community conversation, but really appreciating that for all these years and today, our emergency department effectively serves as the community detox. And we have an incredible team there that can safely and carefully help someone and manage their detox. But an emergency department in a hospital is really not the best place for these individuals. And so we're hopeful that soon, through this incredible collaboration, through this work and partnership, that we will be able to more effectively care for people in our community with alcohol or substance abuse disorders in a better setting. So more to come on that, but just wanted to share that work in progress here today.
Terrific. And it sounds like there will be more updates to come on the work as it relates to that. So we know that it's much needed, and again, appreciate that source, you know, resource for us. So I'm just curious, if not seeing any questions from the audience, just checking our Q&A. I'm not seeing any. I'm also just checking our chat to make sure we've got our links will be in there in the chat function as well. And
Ray, maybe I could offer just a couple other thoughts around, you know, risk of substance use disorders. There's a couple of things, of course, that Valley View are doing on the more clinical end, in addition to sort of the population health end. One of those things, I think we're all, you know, fairly aware of the opioid crisis in America and the risk of opioid use disorder and the unfortunate number of lives that has taken over the last decade or more. One of the big pieces we're doing in our emergency room that I just wanted to mention was encouraging use of alternatives to opioids. So many times people come to the emergency room for pain, lots of different types of pain. That could be headaches, that could be traumas, that could be abdominal pain, a lot of different types of pain. And many of those types of pain actually respond as well, if not better, to non-opioid pain medications as they do opioids. For years, unfortunately, within the medical community, the go-to has often been opioids to treat pain. But we now realize that we can be smarter, we can do this better. And so there are strong initiatives around this. One of those is the ALTO campaign, Alternatives to Opioids, which originally kind of came from the Colorado Association of Emergency Medicine Physicians, but has been expanded beyond that and is now actually going to be included in a new program called the Hospital Transformation Program. We'll have an opportunity to talk further about the Hospital Transformation Program on today's call. But one of those specific measures is around Alto and how we can optimize use of those alternatives instead of an opioid when somebody comes in with acute pain. Even one dose, unfortunately, of an opioid is sometimes enough for a higher risk person with additional risk factors to kind of initiate that cycle towards opioid use disorder. So Alto is an important perspective for our emergency physicians and the staff in the emergency room to embrace. That's just one of the additional examples more on the clinical end beyond what Stacy mentioned around detox or other things. Certainly substance abuse is a big, broad topic, and it takes many facets of how we address that.
Terrific. It's great to learn about Alto and all that you're doing proactively to prevent some of the issues that we see down the road. So thank you for that. I'm not seeing any other questions. Give it just a second. And if not, I can head over back to Stacy to talk about motor vehicle accidents. So I'm not seeing any questions, so I'm just going to dive right in. So Stacy, while no one ever wants to think about being in a car accident, what kind of care does Valley View offer if an accident should occur?
Yes, definitely. No one wants to think of that ever occurring. I think this is also one of the health issues that our community has shared with us. So it is on people's minds. And I think what we do here at Valley View is offer the, a critical level of trauma care through our emergency department. And so it's not just our emergency department, but the full team that we offer here, from neurosurgeons, orthopedic surgeons, just that whole team approach is here and ready to care for someone who unfortunately has had a motor vehicle accident. And so all of our ED physicians are board certified, and advanced practitioners in their field. So I think should that ever happen, we're here for people. And I think what we are now focusing on is how can we be part of creating community awareness about things you can do to prevent a motor vehicle accident. And so we've got a great partnership with our local schools to help educate teen drivers, everything from putting your seatbelt on, adjusting your mirrors. Then I think what we have started to experience more recently is a lot of the motor vehicle accidents that are coming to the Valley View Emergency Department are really due to people driving too fast. And how can we help people appreciate their speed and literally slow down? And so in turn, we can hopefully have fewer people have accidents and be in our emergency department.
So can you share with us the Slow the Roll campaign?
Yes, so this is a campaign that actually the Colorado State Patrol has put together. So we're joining that campaign, trying to push that out, again, creating community awareness that if you slow your roll, so please drive more slowly when you're out on any of the roads, we can hopefully prevent some of these motor vehicle accidents. And then I think separate from that statewide campaign, for a couple of years now, we've been part of a grassroots campaign here in our hometown of Glenwood Springs. It's called Take a Minute. For those who've been through Glenwood Springs, you may have seen the campaign's distinctive green yard signs. Concept behind this campaign is, again, if you just take a minute, slow down while you're driving your car, you're not only going to get to where you're going just about the same time, but you'll also create not only a better community, but also help prevent some of those motor vehicle accidents. So again, just trying to collaborate, whether it's with the Colorado State Patrol or with this incredible kind of grassroots community effort here in Glenwood, and being a part of that. So, certainly would invite the other people who are joining us for this forum to help spread these campaigns. The more we can push them out and just give appreciation to the community that slowing down can really make a difference, the better.
And speaking from personal experience, I'm going to say that you might actually have a lot less road rage if you just slow down and take it easy and not be in such a hurry. And like you said, get there at the same time anyway, and maybe a lot less stressed. So I think we definitely can all use that.
Yes.
We do have a question. And are there resources available online to help share the campaigns?
Absolutely. So on our Valley View Facebook page, you can find the Slow the Roll campaign. And then we can definitely put in the chat here information on the Take a Minute campaign. I know for people who live here in Glenwood, they're always looking for yards to put their yard signs on, or they've got stickers that people are putting on their cars. So we'll add that to the chat here. Great question. Thanks.
Thank you. So I'm not seeing any other questions on that. So I think we're going to bounce back to Rob. And as he mentioned earlier, big focus on diabetes. So Rob, I understand that diabetes is a personal focus within your practice at Internal Medicine. And I'm hoping that you can share how Valley View is caring for patients with diabetes.
Yeah, great. Obviously, big passion of mine clinically. But something that's beyond just myself and what Valley View offers for the community and for our patients. So, the first thing I'd mention is diabetes isn't just about treatment, but it's also about prevention and encouraging healthy lifestyles and offering programming around that for at least type 2 diabetes can be imperative in helping lower rates of diabetes. We're fortunate here in Colorado in that we have typically the lowest rate of diabetes in the country, which goes hand in hand with the generally the lowest rate of obesity in the country. And not surprisingly, the most number of minutes of average physical activity for any state in the country. Now, sometimes that'll go back and forth a little bit from state to state, but we're always in the top 1 or 2. So certainly our work is a little bit easier than in states that might have higher rates of diabetes, but nevertheless, it's a condition that we see plenty of, whether that's type 1 diabetes, type 2 diabetes, or something in the middle. Certainly, there's more complexities to it than that, but very important that we offer compassionate care for all of those individuals. I wanted to just make a quick mention for our virtual health fair that was offered this spring. Obviously, with COVID, an inpatient health fair was a challenge for Valley View, as it was a lot of the organizations that put on health fairs. So we did what we could to at least offer some information virtually. And there were a number of presentations that were recorded and posted to our public website, including one that I recorded around diabetes. So feel free to take a look at that. I believe Leslie could place that in the chat for us if those who were interested wanted to click over to that when we are finished. And I'd like to pique your interest for any of the other presentations from our virtual health fair on there, because some of them are even better than mine, I must admit. So beyond that, the standardized programming that Valley View offers is critically important. So we offer a diabetes self-management education program. We work through our Health for Life, or also known as our cardiopulmonary rehab department, to offer standardized lifestyle programming, encouraging healthy exercise, healthy diets. We work with certified dietitians and exercise physiologists and diabetes coaches there. We also offer standardized programming for risk factor modification. That includes weight loss, that includes folks who may have had a stroke or a heart attack in the past. Obviously, there's a close clinical connection frequently between strokes, heart attacks, and diabetes can be a big risk factor for that. So the more effectively we can control diabetes or prevent diabetes, the more we can reduce the rates of those other things, complications like strokes and heart attacks. So something I'll continue to touch on throughout today's presentation.
Terrific. So I'm not seeing any other questions at this point. So let's go on to our next section of the webinar, and that is on heart disease and stroke. And Rob, you were just kind of leading into that. So thank you for helping with that lead. So just kind of looking back, it's certainly been an exciting year at Valley View. is it's launched new cardiovascular services. And I'm hoping that you can share, why these new services matter for patients and our community, and give us some insight on that.
For sure. A lot of things that we're doing around a stroke and heart attack, both again on the prevention end, but also on the treatment end. So, first and foremost, I'd say, given the size of our community, given the size of our hospital, it's really remarkable that we're able to offer the 24/7 services that we do. That includes our cath lab for emergency response to someone who could be having a heart attack. And more recently, our cardiovascular surgery line was just launched here in 2021, and is really an exciting new offering through Valley View, and one that we are eager to continue partnerships with for adjacent hospitals and adjacent care facilities, even those who are not directly associated with Valley View, because we want this to be a service that's available in time of need for the patients in our region. And so certainly we could discuss that further, but we were lucky to have a fantastic new cardiovascular surgeon named Steve Jones join this year here at Valley View. Some other things that I would just highlight are some of our existing staff. I believe many of us are familiar with Dr. Laws, who's done a lot in our community around cardiac care. And he, for example, provided a keynote address at the 2021 Beacon Fest. He does a lot of other public-facing offerings and education opportunities. But then also through primary care, most of us probably get the most exposure and opportunity for prevention through primary care. We incentivize preventive visits pretty much through any health plan, but certainly encouraged only more and more through things like the Valley Health Alliance that we collaborate closely with. And so through primary care, it really comes back to evidence-based medicine. Are we providing optimal care and recommendations for prevention based on someone's risk factors? We have things like ongoing continuing medical education for our providers and staff to be able to encourage that evidence-based practice knowledge and to be able to then relay that to patients. So I think Valley View does a very good job at fostering that, and we see that each and every day. Additionally, we're participating with the hospital transformation program once again on a measure that encourages prescribing appropriate medications, like cholesterol medications. Many of us are familiar with the term statins, but statins following somebody who's had a stroke already or a heart attack already is very, very important to help lower the risk factor for maybe having another event. Somebody who's had one event, much higher risk factor for having a second event. So something like cholesterol medication prescribing is a measurable incentive for the hospital transformation program, and one that we are working on ramping up closely for. So beyond that, again, just to underscore the comments I made earlier around our standardized programming through cardiac and pulmonary rehab for lifestyle programming, and a couple of other things I'll just mention. I know I'm talking a lot here, but I just get so excited about everything that we're offering. Low-cost screening tests for risk. So whether that's the carotid IMT study, which is an ultrasound of the neck and has a high correlation with potential plaque buildup that you could see in the coronary arteries around the heart and the risk of somebody having a heart attack, or the potentially even more accurate coronary calcium score, which is a low radiation study CT scan, very focused on the coronary arteries around the heart to see if there's plaque buildup and calcification there. Both very low cost, even out of pocket studies, if individuals are interested in getting those studies to look at their existing risk factors, but obviously sometimes and frequently covered by insurance. If not, we offer that for very low out-of-pocket costs through our imaging department. And I think those were most of what I wanted to mention. But again, just with the evidence-based practice, encouraging the use of new medications that are cost effective in lowering risk for strokes and heart attacks. I'll mention one that I like a lot for diabetes care, historically to lower blood glucose, but more and more evidence emerging around lowering risk factors for stroke and heart attack risk. And that is a class called the SGLT2 inhibitors. Actually encourages the kidney to release sugar in the urine. So although that sounds like it would just be a diabetes medication, we find that it also lowers blood pressure, it lowers the risk of swelling, and for somebody even who's had an event already, can dramatically lower the risk of a second event. So encouraging use of appropriate medications like that requires continuing education that we continue to offer here at Valley View for our providers for that interface with patients at their primary care level.
Wow, thank you. Lots of very, very important information. We do have a question, and the question is, are there common symptoms to look out for to help detect a heart attack or stroke?
Great question. Usually the answer is no. That's why strokes and heart attacks are scary. We do a lot of things to help recognize those risks when they're there. If you go into your doctor, they might use a calculator, and they're public facing. You could Google that if you wanted to, the AHCSV calculator, where we can plug in some different metrics like your cholesterol panel and your weight status and your age and your sex, and kind of determine over the next 10 years, what's the likelihood that this individual could experience a stroke or a heart attack. And based on that percent that the calculator gives us, it really sort of sets the stage for how aggressive we need to be to mitigate that risk. But as I mentioned earlier with the coronary calcium score or the carotid IMT, those may actually be more of a gold standard, because if somebody already has disease present, really that sort of trumps the risk factors that we might put into a calculator. If somebody has a big coronary calcium score, well, calculating their risk factors based on sex, age, and cholesterol panel is sort of a much lower evidence-based piece than what we're actually seeing on those studies. So things to keep in mind. But as far as symptoms before somebody could have a primary stroke or a heart attack, usually none. Occasionally, sometimes people could have something called stable angina, where they might have chest pain that comes and goes, especially with activity. But chest pain is certainly one of those symptoms that we would encourage you to get right into the emergency department for, don't pass go, to get evaluated for, because that could be serious. And it's not always a heart attack, but there are a number of different serious conditions, including heart attack, that could cause symptoms like that.
Well, thank you so much. It's just incredible to know about the cardiovascular team at Valley View, the new additions, and everything you're doing in working to prevent heart disease and stroke. So it's such a wealth of knowledge that you're sharing with us that I know we all appreciate. And we thank you. So with that, I'm going to jump into the next section, which is on cancer. And Rob, I'm going to go back to you again. So we're
Sure.
putting you to a lot of work here. So obviously, so many of us have been touched with cancer, either through personal diagnosis or diagnosis of a family member or a friend. We all have been touched. Can you share how Valley View is caring for patients with cancer?
Sure. I couldn't think of a place, DeRay, to go for treatment that could be more personalized and a compassionate experience. I really say that from my heart, in that the patients who I care for in primary care and friends and family members who I have in the community, as you mentioned, who may have experienced cancer either personally or through a loved one, just recurrently have such a positive treatment experience through Valley View and our cancer center. So that's usually not why someone would choose to come to Valley View to have their cancer treated, but I think it's such an important piece of it. So why, if somebody had, a cancer diagnosis, would they want to choose Valley View? First and foremost, I would say because our technology and our expertise are second to none. That is so important. If I had a cancer diagnosis, I want to know I'm getting the best care, and I can guarantee that we are offering that through Valley View. It's also so important for someone to be able to stay local for that care if they desire to do that. And I think most of us would desire to do that should we experience a diagnosis like that. Having to go long distances to get good care when we have that exceptional care locally, it almost makes it an easy decision to stay local, to have your support network around you. We know that those social elements oftentimes are as important as some of the medical treatments we provide directly. Our social support network is so critical, not only with cancer, but with a lot of things that could go wrong with our health. So those are the first pieces I would highlight. We're excited to make a couple announcements around our cancer care offerings. Not only do we have both medical oncology and radiation oncology through Valley View, but we also are bringing our new medical oncologist this fall, Dr. Alex Donovan, a new medical oncologist, female provider who will be joining us this fall as a full-time oncologist. Not only is medical oncology important for the obvious reasons in treating cancer care, but it's a critical partnership for our primary care providers. Medical oncology scope is even beyond cancer to look at blood disorders and some of the more common things that could come back on lab interpretation. And sometimes we need help sorting all that out. It's pretty technical pretty quickly. And even though we try to stay up as best we can in primary care, it's nice to have a local resource, a trusted resource who you can turn to quickly to get those answers. And we have that with our oncology team here at Valley View. We know them on a first name basis, and that breaks down a lot of safety barriers, and it really helps facilitate the best care quickly in a local environment, and that's what we want to really offer our patients. Additionally, we have begun offering something called Brachytherapy. Dr. Rossi, one of our radiation oncologists, now offers that locally. So specifically, that's around treatment of prostate cancer, where radioactive seeds or BBs, if you will, are sometimes placed in the prostate to help just locally treat that prostate cancer. And that's fairly advanced treatment techniques that are required in collaboration with surgeons. And Dr. Rossi is offering that treatment through Valley View. Additionally, excited to just highlight Dr. Betsy Brew, who is a specialized breast surgeon. So not a plastic surgeon, but a general surgeon exclusively focused on breast surgery. For anyone who has known a loved one or maybe unfortunately been afflicted themselves with a breast cancer diagnosis, more often than not, the first treatment modality for breast cancer is usually a surgical intervention. And so it's so important to have a really trusted partner with that breast surgeon. And Betsy Brew, I cannot imagine anyone more approachable and likable and that you would want at your side providing that surgical intervention. And so also nice to have that female provider in that time of need. So Betsy Brew working closely with Dr. Weathers, one of our radiologists who does specialize additionally in breast imaging interpretation. And then I wanted to highlight that we offer another screening modality. So again, not treatment, but screening modality. So something many more women would be exposed to on the screening front. Beyond mammograms and the advanced 3D mammography that we offer is now a special technology to screen women with more dense breasts. So of course that varies woman to woman, but some women have more dense breasts, and we classify those with a score. And for those with more dense breast, having that ultrasound modality, which is very specific, is something that we're newly offering here at Valley View within the last year, and something that your primary care provider could recommend if that was appropriate based on that scoring. So a lot of things that we're doing around oncology, not to mention the outreach to adjacent facilities. Our oncologists are now working closely with those at Grand River and Aspen Valley Hospital. For example, Dr. Mayer providing care in both of those adjacent facilities and maintaining close partnerships and collaborations with the other providers at those facilities. So nice to keep all of that care local, whether that's honestly through Valley View or one of our adjacent facilities. We want to keep it local for folks.
Wow, that's tremendous information. So helpful for our community. Love the announcement of our new medical oncologist coming this fall. So that's some exciting information. And we have a question. So here I go. It's great that you have these advanced treatments available. How can you best support a friend or family who is going through their treatments?
Yeah, we offer a lot through Valley View. Of course, the social network that exists for any individual is probably first and foremost, and how do we optimize how that network can work together to support that person. Our Integrative Therapies department through Valley View is very unique, offering truly the top level of compassionate care with, meal cards and massages and aromatherapy and things that, on the surface sound like, well, that's not really treating the cancer, but we know actually it's bigger than that. If we treat the whole person and we keep the person comfortable and in their social network, outcomes are better. It's not just the medications you receive or the radiation therapies that are offered, but if that person has a better mental well state of being, the outcomes are improved. And so it really is about treating the whole person. And we do that very effectively through our integrative therapies offerings. And those are all provided free of charge for patients. We don't bill insurance. We don't bill patients out of pocket. Those integrative therapy services are really through the philanthropic activities that are provided through Stacy and her team, including fundraisers like the upcoming Rally for Valley. That's on September 11th. If you're not signed up yet, please hold the date on your calendar, because we really look forward to having as many participants in that fundraising event as possible. Even if you don't donate a lot of money, we'd love to have you come out and show your support for our existing and prior cancer patients, and how much we really band together to treat and prevent cancer here in our community.
Well, I have to add that what an unbelievable resource. I was recently in there and was able to see all the different offerings there, and was completely blown away by what is being offered. And, the perspective of there are integrative services that can help the individual. And I know even some of the family members that are supporting the individual going through cancer treatment. So it really is a very, very unique resource that we're so lucky to have at Valley View, and it really just was fantastic when I visited. So thank you for that. I think we're good on questions. Give it one quick second in case anybody is typing, but with that being said, I think that means that we might be done here. And I want to thank everybody for joining us, certainly, and the panel. You were fantastic, of course. Great takeaways. I like to call it snackable information, healthy snackable information, we'll call it, takeaways for everybody. So again, I want to thank Claudia Paul, who handled the Spanish translation for us, Josh Anderson, Stacey Gavril, Rob Nelson. Thank you all so much. I am DeRay Ross. I appreciate you all tuning in, and hope everybody has a fantastic and healthy day.
Thank you, DeRay. Thank you, everybody.
Thank you.
Bye.
Bye.